start talking. Hello everybody, it's Beau from BEAU'D Not Broken. We're here live on Periscope. And we have a really old friend today who's going to talk about something that's obviously very, very difficult probably to talk about, but wanted to talk about it and reached out. And we'll get started in just a minute, but I want to thank everyone that watches each day. If anybody would like to be on the program, please text me or email me or something like that. Let me know you want to be on the Daily Bend, and we'll try and set up some kind of schedule. We download this onto BEAU'D-NotBroken.com, and I want to thank Dustin yesterday for the show up in Midway, for his just his ability to kind of move everybody and his candor about his addiction and the whole story. I hope that hope he gets more and more exposure as time goes on. It was really cool, and I think he's going to help a lot of folks. So we're out here in West Jordan, Utah, in the United States, for those that are watching from somewhere else outside the United States. And again, this is the Daily Bend. I break in every once in a while if you've watched the show and say, this is what we're doing, yeah, that kind of stuff. And so Renee and I have known each other since we were like really, really young. I was a young copper, and I
think I was still a young high schooler.
You were still a young high schooler, and Mom, and I worked with her mom, Charlotte, and in the dispatch center in South Salt Lake, and Charlotte became secretary and executive assistant, things like that. And Charlotte will probably watch this eventually, and she kind of set this thing up, except Renee was very, very nice about wanting to be on, so it wasn't like I was pulling any teeth. But anyway, long story short, it's nice to see her again. All her kids are very close. She's got a grandchild now, but I think isn't your oldest my Duke's age,
well,
right?
Rose was 27.
27, yeah, okay, a little bit older. Oh, Rose was old. Okay, all right.
And Kevin's 25.
Oh, okay, so they
were a little older.
They were a little older, okay. Anyway, Wade, thank you for being here. Tell us about, this is really the story of Rose today. So we're really going to talk about what happened, and then we'll talk about some other things. But kind of let us know what went on.
Rose was born in 1988 as a premature baby. She was 7.5 weeks early, only weighing 3 pounds. But, you know, they said she was healthy. We brought her home in 10 days. She had a normal childhood, got sick a lot with strep or, you know, thrush all the time, but other than that,
nothing any different than
any other kid, you know, you'd say. And, you know, she went through school, 6th grade came along, and she started getting a little bit more, I wouldn't say sick, but started having more problems like with asthma and just allergies. They kept saying it was allergies and asthma. And, you know, she did okay. 7th grade came, 8th grade, 9th grade, she started passing out in school. Still, doctors would say, I don't know why, because, you know, they couldn't figure. It wasn't her asthma, because all the tests showed okay. It wasn't this or that. They could always tell me what it wasn't, but they couldn't tell me what it was. And then when she turned 17, our life changed forever. So
you had, up until this time, you're watching the Daily Bend here on Periscope, and it'll be on BEAU'D Not Broken. We're with Renee. We're talking about Rose, and so up until she was premature, but not a big deal. She had a few kind of issues that were going on. The doctors could tell you it's not this or it's not that, but they couldn't tell you what it was. And then 17 came around, and then what happened?
It was the start of her senior year. And she started to go to school, just like, you know, normal.
Right.
Went to school the first week, got really sick. We thought, okay, well, here we go, you know, it's another infection.
Like what kind of sick?
More like respiratory.
Okay,
more respiratory
so almost
infections.
like inversion, almost like...
Yeah, almost like, you know, respiratory infections. But when they'd run tests, they wouldn't find an infection, but she was running a fever, or, you know, she couldn't breathe.
Right.
So they started giving her steroids. Lots of prednisone, lots of stuff. She did her high school year.
Almost like allergy, but
yeah, but that's
like
and the doctors would say, you know, we're treating her as an asthmatic patient, but we're not showing signs of asthma.
Okay.
It's not acting like a typical What we always got told was it wasn't a typical textbook.
But it wasn't pneumonia type
No, it
stuff.
wasn't pneumonia. They could,
Okay.
well, it never showed up.
Okay.
It wasn't typical, it wasn't textbook cases.
Right.
She did her high school year, her senior year at home, graduated early. Was proud of her. It was the one accomplishment that, she did. She graduated 3 months early. A week before graduation day, to walk down the aisle with her class, we found her on the ground in the bathroom. And I had to do a sternum rib. Brought her to. We took her in. Well, they wanted to say it was a stroke, but it wasn't because there was no signs of it. And once again, we went through this whole, because it's not textbook, they couldn't put a name on it, or they wouldn't give us any diagnosis.
So it was almost like she lost consciousness, stopped breathing, but it wasn't a heart attack. It wasn't a stroke, like
it wasn't
you
a
said.
stroke. And from there, she spent time in ICU after that. We just went from that day up until 2014 or 15. Every year was different. Every year she got worse. Every year we got told, well, maybe she's making it up.
In what way did she get worse? So physically,
she got weaker. She
well?
couldn't walk.
Okay.
At some points. There were days that she couldn't hold her head up. She started having seizures, but they weren't calling them seizures because it wasn't textbook.
And they weren't doing multiple sclerosis.
They ran all the tests.
Everything
They ran tests. They ran, we went through every test that they could think of running. And they'd always say, well, this is what it acts like, but it's not because it's not textbook. And that was what frustrated me. Not every person is going to be a textbook case.
Right.
There are kids out there that are going through this, and people are looking at them like, oh, they're faking it. I know that another lady I was talking to yesterday, she's been told her daughter, her 8-year-old, is faking being sick. What 8-year-old fakes being sick?
So medical people were telling you that that she was faking it.
Yeah, she wanted attention, or
so the symptoms pretty much ranged from not being able physically, muscularly, she couldn't hold herself up.
Neurological.
Did it continue? Did one symptom continue all the way through? So if she lost her ability to move her neck, that would be for quite some time.
For quite some time.
And then another type of ailment or whatever would come into play.
Yes, we found one doctor.
And this is over a 3-year period?
This is over, when she started getting worse, it was about 3 years.
Okay. So she just, when you say she's getting worse,
every
she's
year,
really getting worse.
Every year something else showed up. We went from, they said maybe it was, she got to where she couldn't eat. This was 2000 and I want to say 11 or 12.
Okay.
By this time, she'd already gotten put on disability, which was a fight.
Right. How old was she at this time? So she'd been graduated.
She was 21 when they put her on disability in 2011.
Okay. All right.
And at that, once again, it was, she's not textbook. We don't have a diagnosis to put her under. How are we going to get her on disability? Luckily we found a local lawyer, and she had the best doctor that they assigned to her case to the judge. Mm-hmm. And he looked at her and said, she'll never walk again, or she'll never work again, is what he said, and she'll get worse. At 21, we're like, yeah, right, whatever.
And there's nothing, you're watching the Daily Bend with Renee here. We're talking about Rose and what was happening, and just a few years ago. I get my question. There was nothing that they could even say that was close to whatever she had.
No, they would say
they couldn't say, well, maybe she's got.
They would say it was asthma, like the breathing issues, the chronic lung, the infections. Oh, well, it's asthma related. But then you'd take her to an asthma doctor, and the asthma doctors are like, no, because it's not.
And then she'd have the muscle ailment issues.
She had the muscle ailment. She started having seizures. They wouldn't call them seizures
because...
And
then she couldn't eat.
Then she couldn't eat.
So was she having gastrointestinal issues as well?
Yes, she was throwing up all the time. They took out her gallbladder.
Okay.
They took out her appendix, thinking, okay, one of these things was the cause of it, because they didn't know. After they took out her gallbladder, we thought, well, maybe. And a year later, she was really sick, losing weight. Even though she was on prednisone, which, makes you really big, she was starting to lose weight after that. She got pretty big and started losing weight.
During this time, tell us a little bit about her mindset. I mean, what was she...
I have to tell you, my daughter, to me, is a hero.
Right.
And one strong little girl. As I'm
so
sitting
it was
there,
never mom, woe is me.
The only time it was mom, woe is me is if she was on a heavy dose of prednisone, and it makes your emotions,
right.
You know. But she took it in stride.
Being a woman.
Hey,
I'm just kidding.
now.
Whack, whack.
Yeah, that was on that. You know, that's
that
live.
was trying to lighten it up a little bit.
That was live.
Men are bad too.
But you know, it was. She kept going.
Mm-hmm.
You know, she didn't want to give up. She made sure that she still babysat. She couldn't maybe not work, but she had my niece's kids in the home that she did things with.
Right.
Even if she was sick.
Was she?
She went out to teach dance.
Did she just? Oh, she did. Did she ever get? She must have gotten frustrated as to what was going on with her.
You know, she would. Yes, she would. She'd say, "Well, why can't they figure it out? What's wrong with me?"
Right.
And then she got joking with her favorite doctor she met when he was in residency. She was in senior. And we followed him up until he moved in 2013 or 14. And he was our hero. I mean, we'd look at him and say, this is what's going on. And he didn't give us that look of, yeah, right, whatever. Mm-hmm. You know, he knew she wasn't textbook. Mm-hmm. He knew that he'd say, I like her because she's my challenge.
Mm-hmm. He was almost like an investigative doctor.
Yeah. He loved it because he had to sit and talk to other doctors. And he had to, and he didn't have an answer, but he cared. And that's something whenever, you don't find a lot of, you find doctors that are, I don't want to say they're
no, you can say
their bedside manners aren't necessarily the best. It sucks. Most doctors are, if it's not in the textbook, it doesn't exist.
Right. Or they'll treat something that's not, and
they'll
then
treat,
they'll kill them.
They'll treat the symptoms. Yeah, they'll treat the symptoms, but it's not treating what's really wrong. And I know that they're frustrated because they can't find it. But she kept going. If I was down about it, Mom, don't be. It's my life. I will make the best of it.
Wow.
She did ask why me a few times, and then one day she told me.
Well, that's okay if she did. I just wondered.
And she was on depression medicine because of course you're going to be depressed. She's at this point 20. She got into her 20 and 25. Brother got married. She's never going to be married. That's the whole thing she wanted was a husband and a kid, and that was her dream. And she sees people getting married and friends having babies, and that she'd get a little down at that time.
Right.
But she'd bounce right back. And one day she told me, and this is one thing she told me, I said, why you? And she said, and I found it on her Facebook the other day, she said, I don't ask why me because why me is I was put here to do this. I'm here to teach people to be strong, teach people not to give up, to be a guardian angel when I pass.
Wow.
And
this is on her Facebook?
Yeah, this was on her Facebook.
Is her Facebook still up?
Her Facebook's still up.
Is
and
it
it's
really?
in like one of her notes, and I went and found it the other day, and then I went to find it again yesterday, and I can't get into it. So I don't know if I was playing around with her Facebook. I keep it up.
Yeah, no.
Because her pictures are on there, and I don't know how to get them off.
Well,
all her pictures that she's ever put on there are on there, and I want them.
Right.
So I keep it going.
Wow.
But she didn't give up. Even the last, the last straw was 2015. She got us we'd been in November. We'd been to. Before that, 2014, we were at the Jewish Mayo Clinic or something in Colorado and National Jewish Hospital. And they ran all these tests. And they kept saying, oh, well, she can't swallow. That's her whole problem. She's having problems swallowing. Okay, well, that doesn't make her heart race. That doesn't make her blood pressure drop. It doesn't make, she had low heart rate. She had low blood pressure. She couldn't walk. She couldn't talk. I mean, she couldn't function.
Right.
And you're telling me,
So was she basically wheelchair bound?
Most of the time she was wheelchair bound.
Pretty much. And you had to. How about food wise? Did you have to?
They had to put a tube.
So she was fed.
We went to the hospital one day. I can't remember. It was 2013, I think it was 13. We went to the hospital because she wasn't acting right. Yeah, it was because right before my son got married, and they said her potassium level was at a 1, which, if you don't know anything, a potassium level at a 0, you're going to die.
Right, exactly.
And they said, okay, I've been trying to get doctors to do what they call a J tube, which is like a stomach tube, only it goes in the jejunum, not in the stomach, because if it goes in the stomach, she's just going to throw it up.
Oh.
And
so digest it quickly and go.
So they finally said, we have no option, we're going to do this. So they put the J tube in, and it gave her some strength for a while. But they ended up causing more problems. She finally started getting infections all the time. We couldn't figure out why.
So no diagnosis of what
No
it
diagnosis up until 3
until-
months before she passed away.
Really? And how did
And
that
even that,
occur?
I didn't even get a diagnosis. I got told, well, in June 26 last year, I took her to the hospital, went to a different hospital because my thing with big hospitals is you go in there as sick as she is with an immune system.
So almost a year ago, you went in
Yeah.
the hospital with her. Okay.
Took her to the hospital.
Took her to the hospital.
Once again, we can't figure out what's going on with her. We're going to just release her because we're not treating her. And I'm like, she's having febrile seizures.
Right.
Well, because her fever, her temperature, core temperature was 95, it would get 100 and she'd start having these seizures. And you could see them on the monitor. You could see them if you went in the room with the doctor's like, I don't believe they're happening because her temperature's not 105. Well, to her, temperature is 105
Right.
because her core body starts lower.
Oh.
And because she had no immune system, it wouldn't regulate her temperature right. And so we ended up in a nursing home. And I was at my wit's end. You've got this girl who I'm watching dying in front of me and I don't even know it.
Right.
I've never been told that she had a certain amount of time to live.
Right.
I was still hoping for the best.
And you couldn't treat her for anything
they
specific.
couldn't treat her. No, they put her on an antibiotic because of the blood cultures they were doing, it would show that she had an infection.
I look at that every once in a while just to make sure we're still.
But it won't show them where the infection is.
Right.
And so at the last straw, I thought, this is going to cost me a fortune, but I don't care at this point. I'm going to call Mayo Clinic and we're going to take her to Phoenix. So at that point, we were transitioning into another nursing home because the one we were in.
This was about a year ago.
Yeah.
Okay.
We transitioned to another nursing home that was more skilled to take care of her.
Mm-hmm.
And it wasn't an Alzheimer's home. So because before she was in with the Alzheimer's patients. And what 27-year-old wants to be in with a bunch of Alzheimer's patients?
True.
So we put her in this other nursing home. And we went down there on August 1st. My sister and I drove her down. And we knew the drive down there that she wasn't doing so good.
Right.
The day before we left, actually her doctor at the new nursing home told me, he goes, I give her 1 year to 2 years to live because of the infections. He goes, these infections are going to kill her. And I'm thinking, okay, you've only seen her once or twice. What do you know?
Right.
I asked the doctor she was seeing at the time, her family doctor, the same question. After he told me, I called him and he says, I'd say, 2 or 3 years. But yes, an infection's going to kill her. And they all have that's the thing that upsets me, is they all had the same blood work. They all, because every test that she had went to all of her doctors.
Mm-hmm.
So somebody should have caught something.
Sure.
And
so you're headed to the Mayo.
Headed to the Mayo Clinic. We get in there. I found the best doctor at the Mayo Clinic, that they had. We took her in. He looked at all her paperwork before we got there. He had all her labs and everything. And we walked in. He goes, "Okay, well, I have news, and it's not good." And as a mother, you're like, "Okay, what are you going to tell me?" And he said, "She has no T cells."
No T cells.
Yeah, which means, he goes, compared to an AIDS patient, she's worse than any AIDS patient I've ever seen.
So her immunity
is gone.
nothing.
It was gone. She had no T cells. She had no antibodies.
Okay.
He goes, they're nothing. There's nothing left. Her body is attacking itself. Her body is allergic to itself.
Okay.
Now, at this point.
Right.
Was it the steroids? He said he didn't think so. That's because everybody's like, oh, it's just because she was on prednisone her whole life.
But it was probably steady. The T cells probably steadily over those 20 some odd years.
Yeah, and he said, and that's what he said. He goes, I guarantee you she had this at birth.
Really?
He goes, it wasn't caught because what I'm telling you is she has, and he says it's the weirdest thing. He goes, but I'm gonna tell you, she has a rare undiagnosed disease. He goes, so I'll give you a diagnosis as a rare disease, a rare undiagnosed disease. First time I'd ever heard of it. What the heck is a rare undiagnosed? So you're telling me there's something wrong, but you're not,
Right. And
he said, and the reason they're not finding where the infections is because they won't, because there's no antibodies to tell them. There's nothing there left.
There's no good bacteria to tell them
where the bad bacteria is.
Wow.
Her body was shutting down. It was killing itself. And he told me you have 2 to 3 months.
2 to 3 months.
Yeah. Okay. Well, actually, I think he said 3 to 6. She lived 2.
Okay.
He said you had 3 to 6 months. And I just went, wait a minute. At the time, though, you got to think about it. It was a blessing, and I know that's weird to say.
So you lost her in what, September?
We lost her in October.
October.
Yeah, we lost her in October.
And there was no way to treat it. There was
we
way
kept her,
to treat it.
There's not, antibiotics. She could live on antibiotics, and it wasn't doing anything. And I had asked her, after the doctor said what he, had to say, he left the room. And he said, there was an option. We could try to take her off all the medicine that she was on. Try something else and see if that would work. But the problem was because her body was shutting down and she was allergic to everything, including most medicines.
Right.
He said that would only give her a 2% chance of changing anything.
She would have had if I understand it right, she would have had to have her own good cells to help fight the bad cells. But she had no good cells. And there weren't any drugs to enhance.
No, and they, like he said, there were some like you would give an AIDS patient or a leukemia patient.
Right.
But he was afraid that with her, it only would give her 2% chance of surviving.
Wow.
And if they did it, she would probably die within a week or two.
Right.
And so
she
they were going to have to
away down there.
No, she passed away at home. I asked her, I said, what do you want to do? This is you. We can go through these tests.
Right.
Mom's by your side. I've been by your side this whole time.
Wow.
We can do this. And she said, Mom, I want quality versus quantity. I want to live the rest of my life that I have, not being tied to tubes.
Wow.
Not being in the hospital.
Right.
Not, I want to enjoy what little bit of life I have, which was hard for a lot of people to accept.
Sure.
And that's one thing, I wanted to get out there is just because somebody's ready to move on doesn't mean they're giving up. Mm-hmm. We were told by people that I thought were good friends, people that she trusted.
Oh, you mean when she said,
she had them take her stomach tube out. Well, you're killing yourself because you're not eating. She ate. It didn't process. Right. But she, kept.
Right.
The feeding tube was causing infections. It was causing pain. She wanted to live pain-free.
So your point is really letting someone go the way they want to go.
Yeah. Don't don't feel like they're giving up just because they're not going forward anymore. She fought the biggest fight of her life, her entire life.
Yeah. To
live for 27 years, you know. And she didn't give up, but she was done. She was tired. She didn't want to be in the hospital anymore.
Right.
We took her feeding tubes out. They did keep her on antibiotics. The nursing home she was in was wonderful. Mm-hmm. They asked her, "What's your bucket list?" Mm-hmm. And her bucket list was Disneyland, which I already planned for in September, so I had that covered. If she lived that long, she wanted to dance with her daddy in a wedding dress. She wanted to ride on or sit on a motorcycle, which she didn't want to ride it because she was afraid of him, but she wanted to sit on one. She wanted to go to a Bees game, and she wanted to make sure mom and dad was not financially...
The dancing with your dad one just got me.
Yeah, she wanted to dance with her dad. And she wanted to make sure, and this is what got me, she told me, I don't want you to have to pay for my funeral and take everything that you have from the family of getting a house, because we want a house, and I'm not going to live to see that house, but you will. Right. And it killed me. They threw a bazaar. They raised money. We actually did get most of her funeral costs paid for. Right. By people we didn't even know. Right. We had more support from friends and other people than we did some family members. Mm-hmm. They either didn't A, want to accept it, or B, they were too busy. And this is one thing I want to say. I don't want people to get upset. I don't want people to think, oh, she's blaming me. Right. I'm not. I'm just wanting people to know that when you have somebody in a position where you don't know day to day. I mean, we lived for 3 years day to day not knowing if she was going to wake up the next day. Right. Don't wait to tell somebody you love them. So, yeah, you're not judging anyone. We're not judging. You're asking others not to judge you guys and whomever, but you're asking for people to love unconditionally. Yeah, love unconditionally. I'm not blaming anybody because that would be rude. That would be wrong for me. Right. Just take time out of your busy lives to tell somebody. A card. I make cards now, and this is one thing I do. I make cards, and if I see somebody having a bad day on Facebook, guess what? They're going to get a card in the mail. That's sweet. Because sweet. I don't want people to know, and I got that. So when was it? When was this taken? This was her senior year. Her senior year. The end of her senior year. Oh, that's a cutie pie. This is our favorite picture. So eventually, the diagnosis became what? Undiagnosed. Still the undiagnosed. Her diagnosis was undiagnosed. T-cell problem. She had everything from neurological to immune system. Well, yeah. She started where she had her seizures were worse. She couldn't remember things. And she had a stroke in 2012, and they told me it wasn't a stroke because how you look at the tests, and she had no memory. Oh. And since then, she was 27 trapped. She was 10 years old in a 27-year-old body. Right. Mentally. Right. I mean, there were days that she had great. days.
Right.
And that's what people didn't understand is you could look at her and say, well, she doesn't look sick.
Right.
You know, and she would have a good day, but for every good day she had, she usually overdid it because it was the good day.
Right, right.
She'd have 2 weeks of bad days.
You're watching the Daily Bend. We're talking to Renee about her daughter Rose, who passed last year in October from a rare, undiagnosed, most likely some type of T-cell disease that where she didn't have any, nothing, no way to fight off any type of infection. It wasn't AIDS. It wasn't
leukemia. They said this is what it acts like, leukemia, but it's not leukemia.
So since then, you have learned of others. Is that
have.
correct?
I thought after my daughter died, I thought, okay, this is the worst thing in the world. She died for nothing.
Right.
We have no story. I have nothing left. I dedicated my life to her. I quit my job. I made sure that I was with her 24/7. And I was lost. And then I was reading online. I have a friend that's daughter danced was one of the little students in one of the dance classes my daughter taught.
Right.
And she had heard about this girl who also had some rare form. Well, through that group and listening, watching her, I learned about this group called RUN, which is Rare Undiagnosed Network. They're here in Utah.
Makes sense.
And I found out that 1 out of 10 people whether it be a friend, family member, colleague, knows somebody who has a rare undiagnosed disease. And half of those are children.
So 1 out of 10, which is a lot. I would think 1 out of 10 people knows someone that has a rare undiagnosed disease.
Yeah.
Wow.
And half of those are children.
Half of them are children.
Half of those are children.
Wow.
A lady that I talked to you about, she has some form, but so does her 3 children.
Oh, really?
Yeah.
So, wow. We're going to talk to her hopefully in the next week or so.
But I learned that I wasn't alone. I went through this alone. I don't want any parent.
Right. So tell anybody out there that might have, or know of someone, does the organization, is it made up? Is there a website?
You can get to them on the website. You can get to them. It's called, I think it's called Rare. There's a Utah website, but if you go on Facebook,
I'll look for it as well.
If you go on Facebook and you type in RUN or Rare Undiagnosed Disease,
okay,
and it'll pull up.
Okay.
This group here in Utah, they're there to try to financially support, fundraisers to help these kids.
Right.
Support for their family. As far as helping them get through things.
Right.
Talking about issues. They want to make it so that every child's treated the same. That there's doctors out there that need to learn to be caring. They want to make it so that there's people out there understand that just because a child is not textbook, they're not making it up.
Right.
What child wants to be sick?
Is there any, as you've been part of this group, kind of my last question, has there been any, I guess, correlations between Rose's, death and her, her life and maybe some other people? Is there anything to be said for this T-cell phenomenon, are they all different?
A lot of them are different, but yet there's got to be a common denominator.
Right.
And I don't know as much about it because, like I said, I just learned about this group.
Right.
But I know they're doing something called. They want to have so that insurance and stuff will pay for it. I think it's called genome sequencing.
Okay.
Where they study the DNA. Sometimes your DNA will be fine, and sometimes your DNA will fight with itself.
Oh,
type thing is how I'm understanding it.
Yeah.
But the one thing that even to these people out there on RUN, I know it's hard to think of your child dying.
Right.
But be prepared, because I wasn't.
Right.
And we got the last 3 months to. I'm not saying that every child's going to die, because they're not.
Right.
But if there's that option, don't wait till the end. Make your arrangements, because you know what? If you wait till the end, you make decisions, you get things you don't need. It costs a lot more for a funeral than if you wait till the end. We actually, because we did it in August and she died in October, they actually gave us a discount saying that we pre-planned her funeral.
Right.
Which I got slack from.
Right.
But she told me how she wanted it. She didn't want a religious funeral.
Right.
She believes in her higher identity. She believes in God. He talked to her several times. He told her in June that she only had short time.
Right.
You know, and that's when we knew it was time.
Well, for anybody to question that spiritual,
yeah, you know, she had a connection with,
yeah,
she had a connection with her grandmother who she never met, my husband's mother. And several times she'd say, I'm mad. And I'd say, well, why are you mad? Because Grandma told me it wasn't my time yet. But in June, she told me, Grandma says I only have a short time.
Wow.
You know, and then I hadn't even heard yet that she was
right.
only had this amount of time, you know. And so just plan for the worst, hope for the best.
That sounds like some
and don't give up.
Well, and yeah, anything. I love to allow a guest to close. It sounds like you've done a lot of that. I'm not trying to put you on the spot, but what would you tell, you know, somebody that might be going through, well, is or could be going through something like this? What are some of the things, a couple things that you've learned? And, you know, don't give up is one, obviously, but
don't give up. Fight for what you believe in. You don't have to take a doctor's answer. You can fight. You know, the hospitalists, since, you know, most of the hospitals are not hospitalists.
I had a gentleman by the name of Lindsay Coleman on, and he had ARDS, which was a rare disease, but it's diagnosed. And it's the same thing. He wouldn't believe the doctors. They'd question. His wife would question every drug. And so what you're saying is question that and read up and try and be as educated as possible. And
if a doctor says it's not and they want to release you, you don't have to be released. You can push for other things.
Okay.
I had to push to keep her in the hospital lots of times because it wasn't normal.
Right.
But don't give up. Don't judge somebody by the looks. And be strong. You know, she never gave up. Even at the end.
Wow.
Even at the end when people were saying she was giving up, she wasn't giving up.
Right.
She was tired.
Right.
And she was ready to go home.
Wow. Well, there's not a whole lot I can add to that one other than thank you very much for telling your story. She's always been like a little sister or a big sister. Little sister. I think I'm older.
I'm not too sure about that.
I don't know. But anyway, she's always been just very, very fond, the whole family. And I'm thank you very much for telling the story because I hope it may help some people out there. And this will live on.
That's why I'm doing it.
This will live on and I'll make sure you have the YouTube site and it'll be on my site as well. But this is her show. This is about her and how she might be able to help somebody else.
And that's what I wanted. I wanted her situation and our life to help somebody because I don't want anybody to go through it alone.
Thank you. Thanks a lot, really. Thank you very much for watching. Remember, it's all about the Bend, and thank you very much to all our guests. I know some of these situations are hard to talk about, and they rise to the occasion. I mean, you've kept yourself just amazingly composed. I don't know if
I'll break down after he leaves.
Okay. Thanks everybody for watching. We'll see you tomorrow with another show. Take care. Thank you very much.